Welcome back to School of Speech, the podcast for school-based SLPs at every stage of their journey. I'm your host, Carolyn Dolby, and today we're revisiting a favorite episode that is packed with guidance for anyone navigating a school-based clinical fellowship. I am joined by my longtime colleague and really good friend, Julie Barber-Bristol. If you're a CF or just starting your school-based journey, this episode is full of practical strategies you just don't want to miss. Julie brings decades of real-world school experience and knows exactly what it takes not just to survive, but to thrive in your CF year. In this classic conversation, Julie shares her top 5 tips for success, from mastering assessments and data collection to planning meaningful theme-based therapy, staying organized, and really building confidence. We also reflect on lessons from our own early careers and what truly makes a CFY successful, beyond just checking boxes. So, whether you're a CF, a supervisor, or an SLP remembering your own steep learning curve, there is plenty of school-based wisdom to revisit here. So, sit back and enjoy. Real talk, real strategies, and timeless advice. This is School of Speech. Hello and welcome, everyone. Oh my gosh, welcome back to School of Speech. Yeah, School of Speech is presented by Speech Therapy PD, and I want to thank everyone for joining us today, and a special welcome to those of you that are joining us on the Speech Therapy PD channel on YouTube. So cool. I'm Carolyn Dolby. I am a practicing school-based clinician, and I am the host of School of Speech. Today's title is the top 5 tips for excelling in your school-based CFY. Each of the episodes are offered for 0.1 CEUs, ASHA CEUs, and I am so tickled to have returning guest, and I have to say one of my best friends, Julie Barber-Bristol, with us today. All right, as we start settling in for an amazing episode on CFYs, we do have a few things to mention. First off, if y'all are in a state that your license requires live CEUs, please be sure to complete all the course modules at the end of today. So before today, the end of today, you need to finish the course modules. But there's one, the most important one is complete course. All right, and you'll find that on your Speech Therapy PD account. Let's see, what else do we need to talk about? Oh, I want to talk about the chat because we absolutely love audience participation. So please use your chat for all those questions and comments you'll have for Julie. She will be answering those throughout the episode. And Julie and I were talking, and we would love, for those that are listening live, if you don't mind jumping in the chat and letting us know if are you a CF right now? Are you a CF supervisor? And then maybe third, have you been a CF supervisor? Just let us know. I'll be taking a look at that. While you guys are connecting with us through the chat, I am going to go through our financial disclosures. For Julie, she is employed as a speech-language pathologist by Cypress Fairbanks Independent School District, and she is receiving an honorarium for her participation today. Thank you, Julie. Non-financial, she is both a member of TISHA, which is Texas Speech and Hearing Association, as well as ASHA. For me, I'm a salaried employee for Portland Public Schools. I'm also compensated for my graduate courses that I teach at the universities, and I am receiving compensation from Speech Therapy PD for hosting School of Speech. Non-financial for me, I am a consultant for school districts across the nation. I also am an ASHA member and also of the ASHA Special Interest Groups 13, 14, and 16. Enough about me. Let's get to know Julie. We do know she's an SLP. She is highly experienced with a career spanning more than 2 decades. Not that you're aging yourself. She holds licenses in New York, in Pennsylvania, and Texas. She specializes in school-based therapy. She integrates children literature to enhance speech and language development. She's currently based in Cypress, Texas. That's where we met. She has she's previously worked at the Capital Area Intermediate Unit in Pennsylvania. I hope I said that. Offering therapy across educational settings. That's super cool. And then in New York, she worked in private practice, delivering services to clients in diverse settings, including the home, preschools, schools, private facilities, hospitals, and nursing facilities. Hey, Julie. I am so happy to see you, and I'm so glad you agreed to come back.
I'm excited to be here. And this is going to be a fun topic because we've all been a CF at one point in our careers. I've had the opportunity to have a lot of grad students work with me, a couple while I was in New York, but the majority when I was in Pennsylvania. I've had one in Texas. I have supervised CFs a couple throughout my career. And it's certainly something that we have all had the experience of completing as we've gone through our educational studies. I think this is a really practical topic for both current CFs and for people who might be coming up on that next step in their education, or for supervisors, just ideas about things that you can do to support your CFs.
Perfect. And it's so important because it's something that we had to go through. And since we went through it, we also want to give good experiences to those that we are going to then supervise. Yeah, I love it. I think this is really perfect timing for this. So where should we start?
I was thinking back to some of the experiences I've had over the years, and I thought it would be fun to start with maybe a funny story from our own CFs. I can go ahead and start. When I worked in private practice, about half of my position was going from home to home for early intervention. And so I would go to the home and see the child for the specified amount of time on a weekly basis, whatever it was prescribed. And I had this one family I went to, and they were twins. And they had their twin speech. And so they communicated. And of course, none of us understood anything that they were saying to one another, but they were having a great time. They had to be about 2.5. And once they got talking, I could tell who was who because one had stronger language skills than the other. But their mother was so impressed with me because I was able to tell them apart. And I would walk in the door and I'd be like, hello, so-and-so, and hello, so-and-so. And she's, I don't know how you're doing that. Little did she realize, and this is something that I think is a speech and language skill, but of course it was my trick, if you will. The one student always wore black shoes and the other student always wore blue shoes. And so I memorized who wore what color shoes. Finally, about 6 months into working with the family, I did fess up that I did, in fact, know who was who upon arrival because of the color shoes they were wearing. And like I said, you could tell who they were once you started interacting with them. But upon arrival, those two little boys were as identical as they came. And so we had a really good laugh about it. And it was one of those moments where I'm like, I felt really bad because I couldn't tell the kids apart. So I came up with a way to do it. And like I said, it made the parent feel good because I could tell who her kids were, but also because we had a great laugh and it just showed that I was observant of her children. So do you have any good stories to share? Or
mine's actually more embarrassing. And I'm going to go, so when I went back to get my master's in speech pathology, I came from the background as a teacher. So I was a teacher, kindergarten teacher. Then I went back to grad school for speech pathology, thinking I was going to just do language because I did literacy and early language acquisition as a kindergarten teacher. But everywhere I turned, everything was swelling, dysphagia. And I thought, oh my gosh, okay, I'm going to give it up and head for this. So I'm so glad I did. So I did actually my CFY in a post-acute rehab. And my CF supervisor and I could not have been more different personality-wise. I'm not sure if it comes through the recordings. I'm high energy, I'm goofy. I'm the dork and a spaz. And she was very serious. Like, because I was a kindergarten teacher, so I'm all like singing and I just have a lot of fun. And she was just very serious. I'm sorry, Susan, if you are watching, this is not a disparaging remark to you. I love you. She was amazing. So the beginning of my CF was a little uncomfortable because I was trying so hard because I was trying to fit in and I knew I was too much for her. But by the end, she was an amazing supervisor. She supported me so much. She gave me so many opportunities. I learned so much, especially with dysphagia. That's scary. And so she is an amazing woman, an amazing clinician. And I blossomed and grew and I love my experience. So then my CF's over and of course she throws this huge party and I get the white coat, the white lab coat. She has a monitor. We fell in love. We started doing stuff as friends outside of work. So this is why it's really funny now. But so then it was when I was working there past my CF, I'm now there working full time as a seed clinician. We're cleaning out the office and I see my resume that I had presented when I went to get for my CF interview. And there's a sticky on it that says, absolutely not.
Oh, boy.
And I'm like, oh my gosh. And she's, oh my gosh. I'm so sorry. I'm like, it's actually funny now that, but
You guys were
she
friends
gave me,
and it was
right. And so I guess my point is don't judge a book by its cover. She probably thought I was, too much or something. And we ended up working really well together for years. And she's still a dear friend. So that's my funny. It's more embarrassing for me. A learning for me too.
A lot of the times we learn from those things. And in my case, it was just using my observational skills just because, again, I felt bad because I couldn't tell which client was which when I showed up. And so you do what you got to do.
I'm really excited because I know that you're such a leader for Sci-Fair.
Thank you.
You are. You're excellent shows and you really champion our discipline for the district. Even though I'm not there anymore, I was there for 22 years. I'm now in Portland Public and I love it. But I know that you've had so many CFs and you've had wonderful experiences. You've had funny experiences. And I love the fact that you are here to really walk us through how CFs and supervisors can really be successful for the year. So do we want to get started in some of those tips? I know you've got a lot to share.
Oh, yeah. I always overplan, whether it's for therapy or for you. I love it. Enough information because I'm a fast talker and I want to make sure that I don't run out of things to talk about. We'll start with when I thought about how CFs come into the workplace, I feel like they come in with a lot of theoretical knowledge and they have some good experience because they've done the required numbers of hours through ASHA, but that's just a handful when you look at the amount of stuff you cover in the course of a career, whether it's assessment, therapy, meetings, you can't possibly cover it all in a few hundred hours. The first thing that I think that both supervisors and CFs need to think about is this quote that I found from Oprah. And I really liked it because I think it speaks volumes. And it goes something like this. Running is the greatest metaphor for life because you get out of it what you put into it. And so when you think about any kind of project or any kind of placement position, whether it's a job or a volunteer opportunity, you get what you put out of it. Get out of it what you put into it. And I think that putting as much into your CF as you can is huge, from both a perspective of a CF supervisor and from the perspective of a CF in their CF year. So from my perspective as a supervisor, I could be training a potential employee. I moved from my CF into, a full-time position and stayed in that position in private practice for a number of years. It sounds like you did the same. So your CF year is really nice because you could be learning the job that you stay with for a long period of time and you've got a mentor for that entire period. Mm-hmm. So as a supervisor, you're prepping like your next colleague or your next equal, if you will. And then the other thing is because you've got a mentor for a 10-month period, or a 36-week period, why would you not take advantage of that to ask all of the questions and get as many of the experiences as you can, especially when you've got a person at your disposal to support you? So I think it's a win on both sides. And so that's why that running metaphor really spoke to me. The first tip that I have is to master the art of assessment. Assessment is huge. In my mind, especially in the schools, a lot of times if you do stay in a school, you may have a student from the time they begin with an initial assessment to the time you dismiss. In the hospital settings, you could do a quick assessment on somebody and they could be transferred to a skilled nursing facility before you do any therapy. But in the schools, you have the potential to work with a client from start to finish. And so I really think about the mastering the art of assessment as one of the most important parts of what we do. So when I think about an assessment, I always want to think about my environment. Am I setting up the environment for success? Just having a good place to assess that's quiet, it's free of distractions. Do I have my table organized? Am I a lefty or a righty? Is the therapy book in a good spot? Do I know the purpose of the assessment? Thinking about sometimes you're just handed a folder and you have very little to go on. So sometimes it requires touching base with other school personnel, perhaps giving the parents a call. If you don't have good referral data, letting you know why this assessment has been initiated, investigating those things. So you're using your time efficiently and effectively. I also think about prepping for the assessment. In the schools, we have a wide range of things that we can assess. We have a wide age range as well. And knowing what assessments might be most beneficial for the child based on all of those other things, the purpose of the eval, what the parent concerns are, the teacher concerns are, and so on and so forth. So I really think that the first step is thinking about, why am I doing the assessment? How is it going to be set up so that I can get the most efficient and effective assessment completed as possible? And I think the most important thing is thinking about prep and making sure that everything is prepped. So you know how to administer the assessments, you know how to, set up the environment so that it's effective. And all those things are really environment specific. And the other thing too is knowing, I know that when I walked into my CF, there was like a closet full of assessments. And in college, I might have given one or two. I took assessments home and studied them to know like how to get the basal, how to get the ceiling, how to familiarize myself with some of the questions. Like I can think of the owls is one assessment that I gave today. I can use my verb tenses as well. And that has some really quirky wording on some of the questions. And so just having a sense of what's coming and what you're going to need to say, looking at some very basic assessments like the one word receptive or the one word expressive vocabulary tests. The higher you get with the receptive, sometimes there's some unique pronunciations for words just because they're higher level words, and making sure that you say them the way the test wants you to pronounce. So I really think that thinking about what you're going to be presenting to the student and having the environment conducive for that and having your prep done ahead of time is going to, one, wow your supervisor, and two, it's going to help you with having a really effective information gathering session. So that's one of the first things I think about.
Oh, sorry, I didn't mean to jump over you, but another thing I was thinking that it might be important to say to a CF, especially if their externships were not in the schools, to also realize the criteria the state has, your district has for the eligibility criteria, because the eligibility in the schools is very different than the eligibility in, let's say, private practice, home health, hospital.
Exactly.
Very totally different animals. And it's really important to know the setting, and the school setting's so different and unique and wonderful.
Yes.
And knowing just the three prongs that they need to understand for eligibility.
Exactly. And that's actually something that I was going to touch on that. So I'm glad we're on the same wave. No, you're good. I'm glad we're on the same wavelength with that, because that's just it. You need to determine whether or not the child has a disorder or a delay present. And then you also need to go through the process of figuring out if that is impacting them in an academic way, which when you're in the private practice or you're in the skilled nursing facility or the hospital, it might be an insurance thing. In the schools, it's how is the impact on education? And that's a really big shift. It's not a shift that I remember being familiar with when I did student teach as an undergrad, actually. But it's not something I remember spending a lot of time on at the educational level. And then the third prong of what we look for in the schools is, do you need a speech path in order to address that need? And so that's a really big shift for parents as well. And when you're doing that assessment, you really want to be cognizant of those three-pronged factors for eligibility. And then also your school district, your state, they're going to give you guidance on how they interpret that federal legislation and so on and so forth. So hopefully, not only will you be getting support for from your supervisor on that, but also your department or your leads or your supervisor, like of your department, not your CF, will be supporting understanding how that procedure does work. So yeah,
And
those are really big questions to
and
be
don't
able
you
to
do you think
answer at the end of the assessment.
do you think when if we go back to planning the assessment for just a second, thinking about coordinating with your CF supervisor, if you're going, when you said maybe you don't have a lot in that referral packet to really walk it through with them, what test would you suggest for this? Because you might be very familiar with certain tests from your graduate program. There might be new tests at your district that they use, maybe collaborating. And if you are a CF supervisor, think about starting up with, hey, we're looking at this referral. These are some tests I would consider doing, just giving them a little bit of
as a supervisor, that's something that I speak through, or I go through that whole process with my CF, especially the first couple times. What are the areas of concern? What are you thinking would be appropriate? I don't usually ask or give a lot of guidance initially. I like them to try to problem solve through it because it's a safe time for them to problem solve. And a lot of times when we're in the educational environment, it's more direct. They're like, do this. So when you're an undergrad or in a grad student program, I found that I was told a little bit more what to do versus having to think through and problem solve what to do. And so when I have a grad student or I have a CF, the first thing I say to them is, what do you think? And how would you approach this? And then I tell them what I think afterwards. So it just opens the conversation up. The other thing that I do is I have a checklist, and we'll get to this later, so I'm not going to spend a lot of time on it, but I literally map out what I'm going to need to gather for each assessment that I do, because a lot of times you may have more than one assessment going on at the same time. And to be able to keep track of what your plan of action is for each student, I do think it's beneficial to have a checklist, but that'll come later.
Okay. Cool.
And then when you get to report writing, everybody has their own report style and everybody has their own voice. And a lot of that is taught to how to analyze information. But one of my biggest tips is to really think about creating yourself a resource binder or a resource folder. Binder if you are hard copy, and a folder on your computer if you're not. What's nice is when you spend a lot of time writing a report, or your supervisor gives you reports and you're like, wow, they worded that really well. Or if you get into a situation where it's just a really challenging report and you spend a lot of time writing up a particular portion of that report, I feel like it's nice to be able to go back. You're never really going to copy and paste per se, but what's nice is if you have another situation that's similar and it warrants something similar, it gives you a jumping off point rather than starting with a blank page. And I'm one of those people that I really benefit from having a jumping off point. So if I have a student, and you can spend hours on reports. And so if you have a student that's, wow, I remember I wrote a fluency eval or a stuttering eval for a student, and I had to really work on how I was describing what I was noticing in my analysis. Sometimes being able to go back and refer to that analysis from the previous or from that other student is nice. And then, of course, I created blurbs, and sometimes this is already created depending on where you work, but each test you're going to have a write-up for to explain why you gave it and what it assesses and what the norms are and all the data that goes along with it. So I have a file on my computer that says I give the self 5, or I give the OWLs, or I give the GFTA. Those are some popular ones, or the receptive one word, expressive one word. So I have blurbs for all those tests. So I literally go in and cut and paste them into my reports so that as I'm creating my report, I'm not recreating the wheel on something very generic. Because when I give the self last week and when I give the self next week, it's going to be the same test. So my test description is something that easy time saver and very effective. So I do suggest using the report writing time savers like those test blurbs. And I also suggest creating the reference folder just to make it easier on yourself the next time you get a difficult assessment and you're struggling for words. Then the last thing that I have with assessment, and we're way behind, the last thing that I have with assessment is to think about how you write your goals. And your assessment and goals are going to drive the whole process. So a really solid assessment and really solid write-up of what you observed, both during standardized assessment and non-standard assessment, parent input, teacher input, observations, all the things, they're going to drive what you pick for goals. And you really want your goals to be those SMART goals. You want them specific, you want them measurable, you want them to be attainable. You're making a prediction with that. You may not know the student well, but again, you're going to make your best guess about what you think they can attain in that time frame, which is usually a year in the schools. And then you want it to be something relevant. And when I think of relevance, I think of it from two different ways. And I try to discuss this with CFs and with grad students because I think it's really important. You want it to be relevant to the kid so that there's buy-in. Kids, especially older kids, why am I here? Why am I doing this? And so that relevance is really important, but I also think you need to consider the relevance for the education. So and I think they're both equally important because you can do speech therapy at a child, but when they're active participants, it's a whole lot more effective. So
I like that. You can do speech therapy at the child or speech therapy with the child.
That's right. And I've made a lot more progress when I have relevance for the child and when there is that buy-in and it's an active participant rather than me doing therapy at you. Because I've had those situations as well. And that's where your rapport and you're explaining and you just have to work for the buy-in. Oh, cool. So those are my thoughts on assessment.
I like
I'm going to jump to the next one.
Let's go.
All right. So the next one is harnessing the power of data. And when I think about data, I'm a data girl. When I think about data, I'm thinking about three different things. In my mind, there's three different kinds of data. There's the data that you get initially when you do your initial evaluation, and that's going to drive your whole process. But then we've got therapy data, which is where I'd like to focus. And then the third type of data, I think, is like your 3-year reeval or your reeval for dismissal. And so when I think about the day-to-day data collection, I want to hit on this really quickly because, like I said, we are behind and there's so much to talk about. I am very systematic and I teach and I work with the CF to be systematic in how they collect data. There has to be balance in my world. There has to be balance between how much I'm collecting data and how much I'm actually teaching because there's a lot of different kinds of data. We can collect data on what we taught. We can collect data on the practicing, and we can collect cold data. I do like to systematically work it into I work on a monthly basis. And so I like to have my data when I'm teaching. So I'm doing the teach and reteach type stuff. I like to have data where I'm introducing concepts and I'm actually, my therapy note would say, introduce this skill, worked on this and this along with that. So that would be maybe like an artic goal. A student gets a new artic sound. We talk about the speech mechanism and your articulatory placement for the sound, like those kinds of things. And then that would be like a teaching session. And then for a practicing data collection session, I might be working on how they did when we only practiced it in medial position. And then for a cold data collection, it would be like, this is the goal and this is how it's written. And I'm going to just collect the data on that and be done with it with no cues beyond what's written in the goal. So I think there's a lot of different data that you collect in the course of therapy. And I think all three are very relevant and very important because we're accountable for the actual goal. But a lot of times the actual goal is not something that we can teach from day one. We're going to teach little bits and steps along the way. So we've got to have those teaching days where we're introducing and we're actually instructing on this is what you need to do to be able to do this skill. And that looks different for each kind of goal that you write. But I also think that we have to think about the practicing of the skill and then being accountable to the goal as well. So there's lots of different ways to collect data. I like to think about trying a bunch of different ways for your actual data collection. Sometimes I use Post-it notes. Sometimes I'm typing on the computer. Sometimes I'm making anecdotal notes on a sheet of paper. Sometimes I've done data collection on address labels and stuck them on the kid's sheet after the therapy session. So there's all of those methods. And then there's also the methods for what you're actually focusing on in therapy. And I think that's really important to think about too. And then one of my tips for streamlining data collection is to think about how you write the actual goal. And so I like to write in very easy calculatable, if that's a word, numbers like blank out of 10 trials or 60, 70, 80% type percentages where it's 10 trials and I've gotten my data for that goal so that I can do it quick and efficiently, because again, we're doing therapy in groups. And that's another component of balancing it, is being able to collect data and balance the needs of the kids in the group.
Absolutely.
That kind of segues right into the next one. And the next one is weaving powerful lessons.
Ooh, okay.
So therapy is my jam. I love doing therapy. You mentioned that I do a lot with literacy therapy, and that's one of my go-tos because we do group therapy. And with a book, especially a very strategically chosen book, we can really focus on a lot of different goals at the same time. And so that's really helpful for therapy. So when I think about therapy, I am focusing on working on a lot of goals simultaneously. I'm working on those goals being embedded in whatever activity we're doing. And I'm looking to connect to a theme so that I can create an environment that is context. And so we can encourage generalization. And so a lot of the research is supporting context-based therapy. Books give us a great context very easily. And themes give us a great context to extend off of the books. But that helps with generalization. Like I said, the context, if you pick a strategic book, you can really hit and target and focus on a lot of goals at the same time. So if you have mixed groups, that you've got articulation, or you've got a student who's working on an expressive language delay, or a student who's working on fluency, you can work on, and I need to be better, a student who's working on stuttering. You can work on a variety of skills within that context. I also think you needed, yes, absolutely.
I'm sorry. I just wanted all of you that are listening, Julie is going through these tips, but I want to say that if you're interested in learning more about the literacy part, Julie's was on, this is the second season of School of Speech. The first season that she was on, she's talking about using literacy in therapy. I just want to throw that out there. Yeah. I'll say it again at the end. Yeah. Okay. Keep going. Sorry.
Perfect. And so that was an hour-long conversation about choosing books and utilizing books in therapy. And so, so that's another topic that's like near and dear, and that I have spent probably 15 years of my career really focused on, maybe more than that. And so anyway, it's really important to me. But the other piece about therapy and using a context and theme-based therapy is that we have to be able to differentiate. Because we are working with those mixed groups. And also we're working with different age levels, not necessarily in the same groups, but it's really nice when you can use the same book for a whole caseload of kids. And so when I talk about being strategic, when I choose books, I'm looking for both age level and I'm looking for a variety of therapy goals and focus areas. So there's a lot of ways that you can differentiate with a theme and with their a picture book. I'm losing my train of thought. So when I think about my pro tips, and this is on the handout, we're looking for that effective context-based therapy. We're looking for children's pictures books because I think they're inexpensive and I think they're readily available, but also because they create that context, which is great for generalization. The extension activities and the books can easily be differentiated, and then differentiating activities and instruction is a really great strategy when you're providing therapy to mixed groups. So when I think about therapy, those are my big go-tos. And I do spend a lot of time with my CF looking at how they can strategically use that one book for the therapy, the whole therapy caseload, and also how they can differentiate it and so that they can see that for themselves. And that's a skill that they take away because of the experience that they had with me. So that's what I think about with therapy.
I love it. I love how you do that. What I like is you're not spending the time on a different book every single time. You're really able to use that one book and then really get, if you choose the book right, get all the different goals for all the different goals that you're working for all the different kids in the group. You're right. In the school setting, it's all group.
It is. And it's really nice too, because research is also supporting. And if you look at the lesson plans in the classroom, I spend a lot of time, we have a lot of pre-K and kinder kids. We have multiple, what we call inclusion classes. And so it's a special education teacher, a general education teacher, it's gen ed peers and special needs students. And so it's like a collaborative. And if you look at their lesson plans, and I do collaborate a lot with them when we pick themes and we pick activities, they're reading the same book the entire week. So if you think about the fact that we only see the kids maybe 1 to 2 times a week, to do a theme with the same book and revisit the vocabulary in that book and give them multiple repetitions with vocabulary, which is something that's research-based. When you look at rereading a book or reading the same book more than once, we provide teachers with vetted videos of the books if it's not a book they have on their bookshelf, and we encourage them during those quiet moments, maybe like a snack when the kids are eating, to reread the book or play the video of the book so that the kids are hearing it more than once. And those are just good teaching practices. Taking stuff that we know from literacy, more teacher-based literacy, and we know from vocabulary instruction, we can build that right into our speech and language therapy sessions by using that same book and theme for an entire month. It's just more evidence-based practice to build into our day-to-day therapy moments.
And I love that for the CF to know that you don't have to just think of a brand new book every single time. Like, work smarter, not harder, right?
Exactly.
Yeah.
And when you think about a CF, the amount of time it took me to write a report when I was a CF versus the amount of time that it takes me to write a report today, it was a significant difference. Everything you do
Absolutely.
takes twice as long. And the other thing is, my bag of tricks is huge. After working for a long period of time, if you have certain themes that you like, you have grab and go material. As a CF, you might not have grab and go things made. So if
Right.
I'm doing a snowman activity, I've got laminated pictures that I can already use. And a lot of times that snowman activity can be used over and over from year to year with different books. And you've got it ready for you to go and grab and use. And those are not the things that you can buy through a commercial company. Those are a lot of the things that you're making at home for therapy. And I always think that it's really important to take that clinical fellowship year or that graduate student time period that a student is with me and say, okay, you're with me for 9 months. That's a whole year. Let's look at what's a book for September, what's a book for October, what's a book for November, and look at themes that are really appropriate for what's being taught in the classroom during those months, and also things that are relevant to the kids, like winter, snow. You get into Thanksgiving, you can get into food, maybe foods that you eat at Thanksgiving. The fall, it's rich with apples, leaves. We love
Sure,
monsoons in October. So you can pick broad themes and then take a book that's very well chosen. And that person could walk away from that experience with you with an entire year of lesson plans, because you've collaborated and you've worked together. And so then next year, maybe they want to pick a different book, but they can still pull out that leaves falling off a tree activity because it's something that's now in their repertoire for the fall season. And again, it's smarter, not harder. It's just being really practical with how you approach things.
I love it. Julie, I know. I love everything that you share with us. All right. Keeping us on time, what do we go into next?
We are doing well. We are back. I talked fast.
Oh, we're back? Okay.
Yeah, we're doing okay.
I want to let our listening audience know that there is a handout for this, and make sure that you grab that. Okay. Yeah, keep going.
So embracing the journey of learning is the next top 5 tip. And when I think about that, it's important to continuously learn and grow in order to practice at the top of our license. Things are constantly changing. I've corrected myself during this very presentation or webinar where I said fluency instead of stuttering. And I know that's a shift that's been made. We're making the shift from nonverbal to non-speaking. We're constantly learning and growing and developing. And you come out of college, and I remember my first year working, I was like, yeah, I did everything the way I was taught. But did I do it great? Probably not. Probably 5 years in, I was becoming more and more efficient and effective and stronger and more developed in my therapy skills. And that was because I practiced, I collaborated. I went to continuing ed. I had the opportunity to just grow and develop as a speech language pathologist. And my philosophy is the day I stop learning is probably the day I need to retire. There's always something new and exciting to explore. And it keeps us fresh. It keeps us excited. It keeps us from burning out. I'm a lifelong learner personality anyway, but I'm constantly doing continuing ed because I feel like it's important. And I feel like it helps me practice at the top of my license, at the top of my game. And not only does it help me practice it, but it helps my kids and my families. Because bottom line is, I'm not in this for myself. I'm in it for the kids. And when I can call a parent up and say, I started with your kid, this happened this week. I started with a kid at age 3 who was not speaking. And he's in the third marking period of his kindergarten year. And we just graduated. And mom and dad were like super psyched. And we were able to reflect on the fact that the kid was not talking when he showed up at school. And now we have full conversations. And he was a kid that therapy was really effective for. He was in an inclusion classroom. We had great collaboration between the speech pathology services and the teacher, and teachers, because we had both the gen ed and the special education teacher and the paraprofessionals. And it's a whole team collaboration because I'm a drop in the bucket for time. But when my time is effective, and I'm modeling and working with my teachers side by side, and I'm supporting them and I'm supporting the student and I'm providing effective therapy, we get great results. And it's really exciting to see that when you put in the time and the effort to build yourself as a provider and in your skills, you become that much more effective for your kids and their families. Lifelong learner.
Don't you think when being a CF supervisor, I've always learned almost as much from them as well. I think an important thing for all of us that are, our supervisors is to be open to some new knowledge. Your point of being a lifelong learner, we can learn from these clinicians that are coming right out of school. They've got the newest trends, hot off the presses, if you will. And so I think it's a great opportunity as a seasoned clinician to actually be open to a new way of doing things. And I think perspective and getting a perspective from your CF is powerful as well. I think that we need to knowledge dump on them because they need that too. But I think being open and saying, what do you think? And giving them that safe space to tell us what they what do you think? What are some ideas that you have? And that it's okay, and be open to that.
Absolutely. And there's times when I've said to students, I don't know. And so we both need to hit the butts. That happened this year too. I had a student come in with a low incidence diagnosis and I had never heard of it. And guess who hit the bus?
Yeah.
And it was a great opportunity. It was an evaluation I did, but I invited my CF to collaborate in that experience because in the schools, you have students that walk through the door. You can't predict, I'm going to have this disorder. I'm going to have this situation. Yeah, we're always going to have our tick cases and we're always going to have some of those basic kinds of things. But when you get a low incidence diagnosis that walks through the door, a genetic condition that is like 1 in a million, you might not have learned about it. And having the opportunity to pick their brains, having the opportunity to demonstrate that I don't know what to do in this situation. So I need to hit the books too and see what some of the characteristics are, what to expect and how to approach this, what therapy is effective for a certain population, for a certain situation. It's great to be able to collaborate with them because again, their experience might be different. I also find, and this just popped into my head, I also have found that from New York to Pennsylvania to Texas, the assessments people use vary based on the region. Sometimes different, I don't want to say philosophies. Philosophies might be the right word. Different therapy techniques are popular based on the colleges that are around. You might have a guru in such and such. And so therefore, maybe a lot of the therapists who went to the college that was in that region have had that professor and they're very strong in that particular therapy technique. I know that in New York, we were seeing a lot of ABA in one part of the state. I worked for a private practice that had offices throughout the state. And then in another part of the state, there was a lot of floor time, Greenspan's floor time. So our private practice, we were trained in DIR floor time. And it's interesting to see that as well. And having a grad student who went to college at College A that might be in the Houston area, and I went to college in New York for both undergrad and graduate school. Our professors are different, their philosophies are different. And so you might have been trained in something different. So it is really neat to collaborate in that regard.
Absolutely.
Today, I actually had a conversation with one of our leads, and she just came on this year to join Sci-Fair, and she is very well versed in bilingual assessment. And I had a very specific question based on an evaluation I was doing, and I was able to pick her brain, and she was able to offer a wide variety of strategies, advice, and stuff because that's her niche. And it was really nice to have somebody to collaborate with because I was feeling like I was in a rut with how I wanted to write up and approach this particular evaluation. And that's one of my tips is to use your people. You've got colleagues, you've got supervisors, you have people who have certain niches, you've got the internet, which is where we can go use reputable sites to learn about different low incidence populations. You can develop your resource list of people that you enjoy or you find their materials helpful. I have certain blogs and websites I like or people that I follow for podcasts. And so there's a lot of different ways to learn beyond just going to a continuing education conference or workshop. And so I take advantage of every opportunity that I can.
And so the benefit of having a CF is that they're now a resource for you. Not only,
Absolutely.
and I love the fact that you're saying collaboration because it is a collaboration.
Absolutely.
And so they can bring as much robust information and perspective too. Getting a different perspective can change it for us because if we've been doing the same thing the same way for 30 years, let's freshen it up and get some new perspective in here. Maybe doing something a new way is going to benefit you as much as your vast knowledge that you're providing for your CF.
Exactly. Our scope of practice is birth to geriatrics. And we have, 5 categories? How many broad categories are there of therapy that we do? You cannot know it all. And that's the one thing about a school speech pathologist is you literally get the case that walks through the door. You're not a specialty in something this or that. And so sometimes in private practice, it's a voice clinic or it's a fluency clinic. It's not a situation. You get the students that walk through the door. And because in an elementary school, we go from age 3 to 5th grade, that's a pretty vast span of language development, articulation development, of fill in the blank development. We have to be well-versed. And I respect my CFs who are willing to ask a question, even if it makes them vulnerable, because I would rather support you and problem solve through it together, whether it's something I know the answer to or not. I feel like it is a growth opportunity for everybody. And if you can't ask questions, then I think it's going to make your career very long because, like I said, a lot of times I'm learning every day. Even my kids teach me stuff. When I pull out a new book, we were laughing this week, my colleague Nicole and I, because we started this one book with the kids. And one kid goes, "Hey, did you see?" And points to a picture. And we said, "Oh, we never even noticed that." And so we learn every day from everything and every interaction. And like I said, and like you've said, it's a collaboration and it's win. And so it's giving back, it's growing, it's all of it that makes it such a great experience.
And I know that you are a very organized speech pathologist. And I love the fact that you are going to talk about the power of organization. I think I am going to learn from this because I need better organization.
Yeah, organization is the name of the game. When you have a caseload of kids, when you have multiple evals going, when you're running from meeting to this and meeting to that, and you are trying to fit in makeups for the ones you missed during that meeting. And I find being organized is the best way to approach this position. So I have 4 major tips that I offer for organization. The first one is I keep a notebook. I have a notebook for every year. I pick one that I love because there's research that says surround yourself with things that give you joy. And that's not a speech research. That's just a life research. So I do have a notebook. I pick one out that makes me feel joyful because I don't like meetings. And I put all my meeting notes in one place. And so when I go to write a report, or I go to write up a summary or new goals for a student, I can go back to the page in my notebook and be like, oh, yeah, that's what we talked about. And so I do need to make sure that I have all those papers not on random little scraps here and there. So the notebook is the way to go, or the journal, whatever makes you feel happy and excited. And then when I'm done with it for the year, I throw it in my drawer. So if I need to reference it the next year, it's there. Because sometimes a kid will come up and we're like, no, that's developmental. But then it's, oh, that's not developmental anymore. Let me see where they were at last year. And you can reference it easily. That's my first one. Second one, I am a huge fan of a calendar. I'm sorry, I'm old. And I still need a hard copy calendar. The only thing I put in my monthly calendar are my meetings and important dates. So like when progress reports are due, when I have meetings for an IEP, when I have staff meetings, when I have department meetings. So all of that is on a monthly calendar. And the reason I do that in just those things in the calendar is because there's too much to put on a calendar otherwise. And things change from week to week and day to day. So I like my monthly calendar so I can plan for the month. And I can say, okay, I have this eval due. So evaluation dates also go on that. And so I've got a running record that I can look at and I can plan for the entire month for what I need to accomplish because due dates aren't flexible.
No, they're not.
And then I do a weekly calendar, and it's literally a Monday through Friday block. And it's a grid. I use a Word document. You could use whatever document works best for you. I've used Word for 100 years, so that's where I'm at. But that has my hour by hour breakdown of my day. And so at the end of each week, I like to end my Fridays by planning my following week. So what I'll do is I'll look ahead to what meetings I have, and literally I will cut and paste and move around the therapy sessions that I'm going to miss because I'm in a meeting. So I try to stay on top of my makeups. And then I also plan in when I'm going to do my assessments that need to be done. And if there's time that has random blocks, I'll be like, so that I know that I should utilize that block to prep for the next thing. And I try to get myself a week in advance with paperwork. So everything is done a week in advance. That's hard sometimes. I would love it to be 2 weeks in advance, but that hasn't ever occurred yet. And then my third I know, right? The third thing that I alluded to earlier in the podcast was I have checklists. And I don't want to pull out the folder for assessment A and be like, oh, where did I leave off? I literally have a checklist that says what I need to do. It has the due date on it. It has the student's ID number, whether or not because some of our assessments are now in the iPad in this fancy online system. And so you have to set it up in the computer and then you have to send it to the iPad. Did I send an RTIC test? It's checked off. Yep, it's sent. I can just grab the iPad and I know it's ready to roll. When I get ready to do an assessment, I get my checklist. Do I need to do this? Do I need to do this? Do I need to do this? Did I send it? Did I not send it? Did I whatever? And so do I have parent input? What date did I send it? Do I have teacher input? What date did I send it? And so it's literally a checklist. So when the teacher input comes back in, I cross it off. When the parent input comes back in, I cross it off. If I have to document that I attempted it 3 times to get that parent input, I've got the dates I've sent it. It's all on that one sheet of paper. And it's literally
is it like a template?
I made it a template.
And then it's like a blank. Okay, Judaism. So Julie, it's a template that you use is this for evaluations you're talking about? I just want to make sure that I've got it.
I have one for speech. Yes, one for speech only IEPs because I've got to call parents. Did I call that parent? Did I not call that parent? Did I get the input from the teacher? And all of that kind of stuff. Okay. And then all the documents that I need to complete. So it makes it a no-brainer. And then I have one for when it's what we call a dual student. This would be a student that has both speech and language services and some other eligibility. So they may have like a specific learning disability, or they might have autism or another health impairment, in which case I'm not the case manager. So I have one for
Right.
when I am
Okay.
the case manager for the speech only IEPs. And then I have one that is for if I'm not the case manager. So if
Okay.
I'm just
Okay.
one of the service providers. And then I have one for assessments. And I created these because we use a certain computer system and there's certain documents that you fill out for each of those three scenarios. Those are the broad categories. There are some situations that require different documents, but those are the most common and the most frequently occurring. They were nice references for CFs in the past so that they could just
Yeah.
be like, okay, I have to make sure I do this form and this form in the computer as well. And I found them very helpful because then with those days where I'm just burnt out, like, okay, did I do that? And I'm like, yeah.
That is a really great trick or a thank you for the supervisors to be providing for the CFs, because we don't want to reinvent the wheel every time. So anything that you can do to help a CF, because everything is brand new to them. So anything that you can do, any of those tricks that you have, those organization things. I love that. Think about,
Cognitive load as well. You don't have to remember
yeah,
everything because you can just check it off. I want to put my energy into the evaluation, the actual report I'm writing, the therapy that I'm doing. I don't want to be thinking about what form I have to fill out. So if I just
Right.
check it off, it's like, yep, it's done. Yep, it's done. So it reduces your cognitive load as a provider as well. I want to be on my game when I'm doing the important stuff, not when I'm, data inputting.
We want to work at the top of our license, and some of this extra stuff is just not working at the top of our license. So being able to show and really get the CF some of these tricks and tips and tricks is what I was trying to say, to take the cognitive load off of them. Yeah, they don't need to
Absolutely.
reinvent the wheel. If you have something, share it, I guess is what we're
Oh,
saying.
absolutely. When I have a CF or I have a grad student, I create a Google folder for them, and that folder has things that I use, and I tell them, these are what I do. This may not be your voice. You may take it and put a spin on it. That's what you need to do because my brain works this way and your brain might work this way. And you need to find what works for you. But these are some things I've tried and they're my tried and trues. And those kinds of things, if I can help you and I can save you that trial and error process, then I'm going to do it. Why wouldn't we? There's no
Yeah.
reason for somebody to stumble through things when we can collaborate on a way to make it easier and more efficient from the get-go.
I think the important takeaway for both the CF and the CF supervisor is coming together, and things that are just rote, help them with that. Things that are rote, give it to the CF. They don't need to reinvent a checklist. If you have a checklist specific for your district with all the things that need to be done, why make them redo that?
Exactly.
But then
And
yeah, go ahead. Sorry.
I was going to say, and also because there are so many things you have to remember. I mean, when you're starting, when I start something new and when our kids are learning a new skill, they're focused on themselves. They're not focused on what I'm
Right.
doing. And when I give an assessment for the first time, I'm more focused on making sure that I say the right words and that I read the information correctly or that I score it right. And so you're hyper focused on where you're, I don't want to say weakest because I don't want that to sound negative, but like where you're functioning. And so I think it's really important if you can take some of that cognitive load off because everything is new to a CF. They've walked into a new building. They don't even know where the bathroom is half the time.
Right.
They're learning a building map. They're learning teachers' names. They're learning kids' names. They're learning where to find the information they need, the copier code. Think about just the day-to-day stuff. And so if you can take cognitive load away for those little things and make it easier so they don't have to remember stuff, they can just grab a checklist or a to-do list and use it, then that's huge in my mind.
No, I think that's the biggest takeaway is you want them to shine. So you want to give them as much help as possible when it comes to those rote things that really it's not something that is going to, it's not making or breaking them as a clinician. It gives them space to grow as a clinician because what you really want them to grow is in their ability for therapy. They need to have all this organization, but help them out. Get them started with that. You're right. Everything's a brand new day. I love that. knowing where the bathroom is. I know it sounds like it's so simple, but I'll tell you, this is not my CF. I'm a veteran clinician, but I started in a brand new school district. And yeah, little things like knowing where the bathroom is huge.
Absolutely. And it's even just knowing where to park.
Yeah.
And I don't know how it is in Portland, but in Cy-Fair where I work, we have like a dress code. And so the dress code is certain days we wear professional dress. And then one day we promote our school. And so it's spirit shirts and jeans on that day. So even just the dress code changes from day to day, depending on the spirit weeks and all these things that might be very new. So I just look at any way you can make the job easier for each other is effective. And like I said, we've all had our trialing of different ways, and everybody has to figure out what works best for them. But if you can offer a solution and then it evolves into what works best for your CF, or your CF shows you something that they learned, or maybe they have a data sheet that they like and you're like, oh, I've never seen it done that way. I like it. And so working together and collaborating and just discussing things, I think, is huge. But organization in a school-based speech pathologist life is, I think, it's the name of the game. There's so many different things we're pulled to because we do it all. We assess, we do therapy, we hold meetings, we attend meetings. We really do the whole spectrum of different skills. And so
As I'm
just being
looking,
organized.
I am sorry, I want to be respectful of your time. We are
Yeah.
getting close to where we need to wrap it up, which I hate because you're just a wealth of knowledge for us. This is amazing. I love it. Thank you so much.
I love what I do, and I love to
Yeah,
share
and it
ideas
shows.
with people and collaborate.
So what is your biggest takeaway for, okay, how about this? I'm going to put you on the spot.
Okay.
I want a takeaway for a CF and a takeaway for a CF supervisor.
For a CF, I think being open, being vulnerable with where you have weaknesses and where you need support, and asking questions. I think those are the things that are most important. They were most important when I was a CF. Like, I felt like I had 101 questions. And I'm not shy to ask questions, but some people are. And so I think being open and recognizing that we have all been there and all of our experiences are different. So the idea that you can't learn it all at school and you shouldn't be expected to is huge. And so being vulnerable to ask those questions that you're not clear on and that things that maybe you haven't been exposed to yet. I think that's the biggest thing for a CF. For a supervisor, I think it's almost the same kind of thing. I think that you need to be open to the CF that comes in and know that their situation might be different than the road you took. I had a grad student a couple years ago who did her undergrad and then did a period of time where she was an assistant and then went back and did her master's. And she was also a mom. And so she had 2 kids under the age of 5. I don't remember how old they were. Here, when I was a grad student and when I was doing my CF, I did not have a child. And so I was just focused on my job and recognizing the fact that we set it up for her to come later. And again, this was an intern, like a grad student. The school and she and I collaborated on this, but knowing that she had to get kids to daycare and she had an hour drive to get to our school. And so I made it an adjustment for her because I was like, that's a lot to get your kids up that early or an hour earlier so that you can be here at 8:00. I'm like, if you want to get here at 8:40 when the students arrive, that's fine because we had a buffer for her to get set up and ready to go. But I think it's important to know what people's backgrounds are and what they're coming in with and the experiences that they've had and trying to support them and accommodate them as well. And that goes for their internships. Sometimes they haven't ever set foot in a school. And and so
I think I love it. So for both CFs and supervisors, be open, be vulnerable. Well, so for the CF is allow yourself to be vulnerable. And then for the supervisor is to create the environment that they are comfortable being vulnerable.
Exactly.
And the way for that to happen would be your third prong that you use is asking questions. Both sides asking questions and being open to being asked in an environment that they feel comfortable to ask.
Exactly.
I love it.
I
I hate
this
to
was
say this, but
amazing.
I know it was amazing. We have come to the end, and I know those that are listening, thank you so much. I just need to remind, as before we sign off, just to remind those of you that are listening live, and that if your state license requires live CEUs, please be sure to complete all the course modules, including the one that says complete course before the end of today, right? And that's on your speech therapy PD account. All right, I want to thank everybody. Thank you so much for tuning in. School of Speech. I hope I see everybody at our next episode. And Julie, I can't thank you enough for coming, and I can't wait to have you on again. And we'll think of another topic for you because you're amazing.
Thank you.
All right, guys. Thank you. All right. Bye-bye, everyone.
Thanks for joining us on today's podcast. Remember to go to speechtherapypd.com to learn more about earning ASHA CEUs. We appreciate your positive reviews and support and would love for you to write a quick review and subscribe.